Welcome, everybody, to the Consortium of Universities for Global Health's ongoing series of webinars. I'm Dr. Keith Martin, the Executive Director for CUGH, and we have an outstanding webinar today on climate information, a new resource for the health community. I'd like to thank the research committee for pulling this webinar together, which, as we know, is extremely timely. For climate change is a clear and present threat to the survivability of all species, including our own. Extreme weather, biodiversity losses, ocean temperature rising, food insecurity, conflict, migration, and much more threatens all species, including our own. This, of course, also includes changing patterns of diseases, and climate information is a powerful tool to understand the impact of climate change on health and also identify what we can do to mitigate the effects of climate change, to prevent, detect, and respond to infectious diseases. We have three outstanding leaders today to give this, and they are Joy Shumake-Guillemot, who is the leader of the WA World Health Organization's Climate and Health Joint Office in Geneva. We have Dr. Simon Mason, who is the Chief Climate Scientist for the International Research Institute for Climate and Society, and Dr. Madeline Thompson, who's the director of the IRI WHO's Collaborating Center for Early Warning Systems for Malaria and Other Communicable Diseases, and is also a professor at Columbia University. So with that, I'm going to thank all three of our wonderful speakers and moderators today and hand it over to Dr. Joy Shumake-Guillemot. Over to you, Joy.
Thank you very much, Keith. I'm really pleased to be with you here today. As you mentioned, I'm an environmental health scientist with a focus on climate adaptation and the use of climate information. And since 2014, I've led this joint office on climate and health between the World Health Organization and the World Meteorological Organization here in Geneva, Switzerland. And this office is really a good example of why we're having this conversation today, because it was created by the two UN agencies that are responsible for health and responsible for climate, specifically to focus on how to accelerate the availability and application of climate information for the health community, because using this type of information is really a fundamental part of starting to adapt to climate change. So those of us that have been working in this space for a while have started to really see time and time again that the use of integrated climate information can really result in more lives saved, more patients treated, reduced disease burdens, and cost savings in health service delivery. So we've seen these demonstrated advantages and benefits of using climate knowledge for early warning, risk monitoring, surveillance, the day-to-day work of public health agencies around the world. And it's really convinced us that climate information and services can help health professionals become smarter and much more agile in response to climate change. And so we hope by the end of this webinar, you all will start to believe this too. So I'm extremely pleased to be chairing this discussion today with two longtime collaborators in this field. So I'd like to introduce Simon Mason, who is the Chief Climate Scientist at Columbia University's International Research Institute for Climate and Society, where he plays a lead role in the international outreach of IRI's climate program and leads the IRI's disaster work. He has played a key role on the high-level task force of the Global Framework for Climate Services and a lead author in shaping this framework internationally. He's also a focal point for IRI's partnership with the International Federation of the Red Cross and Red Crescent in their disaster preparedness. And Simon, it goes without saying, he's really a world-renowned expert in climate science and works closely with the World Meteorological Organization on several expert teams. He has extensive experience in seasonal climate forecasting and has been heavily involved in capacity building, including developing a climate predictability tool, which is incredibly useful for the technical community. And then I'm also pleased to present Madeline Thompson, who is the Senior Research Scientist at IRI, as well as a Senior Scholar at the Mailman School of Public Health at Columbia University. She also directs the Collaborating Center of IRI with the World Health Organization that focuses on early warning systems for malaria and climate-sensitive diseases. And Madeline's research really over the last 25 years has focused on developing new data, methodologies, and tools for improving climate-sensitive health interventions, particularly malaria, meningitis, as well as the health impacts of disasters and malnutrition. So we really have some amazing expertise here with us. The focus of the webinar today is really to break down how climate works and then show the opportunities for the public health community to use this information. So Simon and Madeline will each present for about 20 minutes, and then we'll take questions from the participants. So please submit these in the chat boxes. So with that, I'd like to hand over to Simon to tell us more about the climate.
Good day. Thank you, Joy. And I'm currently speaking actually from Los Angeles in Southern California. And I'm looking forward to, if the weather forecasters are correct, looking forward to a warm, sunny weekend. In contrast to my colleague Madeline, who's still back in New York, where she's busy preparing for a snowstorm this weekend. Now, this east-west contrast in weather across the U.S., the difference between the West Coast and the East Coast, is actually a very common occurrence. And we had a very similar situation about this time last year. I'm showing a map here that is indicating the temperatures as a difference from the average for a week period at the end of 2017, so about a year ago. And you'll notice that in the western part of the USA, it was unusually hot. In the eastern part of the USA and in the central part, it was unusually cold. And this kind of pattern that we see in temperature, and we can see similar patterns in rainfall. We get these kind of patterns not just occurring at weather time scales. We also get the same kind of patterns occurring over periods of months, periods of years, perhaps even periods of decades. So we can see these kind of unusual, persistent or intense weather conditions lasting for much more than a typical lifespan of a storm or another weather event. And so this is where climate scientists start to get interested in the weather. There's a distinction that we scientists make between weather.
We are having some technical difficulties right now and are trying to fix this. So please, we thank you for your patience, and we should be on shortly to resume Dr. Mason's presentation. We're going to switch, Madeline, to you, and then everyone, Dr. Thompson will present hers, and we'll go back to Dr. Simon. Much apologies for this technical glitch.
Hello, can you hear me?
Yes, we can hear you perfectly well. Please go ahead, Dr. Thompson.
Okay, I'm sorry for that. Simon may be enjoying the nice weather, but for the moment we have the better internet service. So I'm just going to take us through some of the ways that climate information can help us in health decision making. And I hope to illustrate how some of the climate science that has been developing over the last few years is really now becoming a potentially practical tool. I do want to start effectively by just reminding the audience that climate variability and change, of course, has a very broad impact on health. Some of those impacts may be very direct, if you like, through temperature increases and heat stress. But we see many climate effects that are mediated by socioeconomic effects. We have a huge impact of climate, of course, on agriculture, Agriculture is a very important part of people's economy and livelihoods, and of course contributes to nutrition, which is a fundamental resource for health. So there are many different pathways that can be involved. Some of these are illustrated, and maybe the audience is more familiar with the pathways illustrated here, where climate can have an effect on civil conflict, the floods and storms can have a direct effect on injuries and loss of life, climate impacting on disease transmission, heat, as I've already mentioned, air pollution, etc. But what I really want to think about in the time that we have available today is what the advances in climate and weather over recent decades have created new opportunities for us. In the past, definitely, we've seen the use of weather station information in health decision making. That goes back over 100 years from some of the early warning work that was undertaken in India for malaria, for example. But in the last several decades, we've got remote sensing tools, we have observations of the sea surface temperatures in the oceans, and we have modeling tools, global modeling tools, which are becoming incredibly powerful, allowing us to not only predict the weather, but think about longer term climate change. And all of these tools are, and I say potentially, relevant to the health community. I'd like to just point out climate as a resource that is in some ways pretty unique. We know that there are many drivers of health outcomes. We know that improving girls' education improves health. We know that distribution of various interventions, whether it's vitamin A interventions or improved nutrition or vaccinations, they all improve health. But what's particular about the climate is that it's a very structured source of information. We know something about the climatology of every region of the world. That means what the climate is normally like. We know that in large parts of the world, there's very strong seasonality, and many diseases are highly seasonal. We have diseases that follow the rainy season, diseases that are associated with the dry season. We have diseases that are in the cold or humid times of the year, etc. And seasonality is a very significant part of infectious disease epidemiology, but sort of goes beyond that as well, and nutrition being an excellent example. Climate also has a natural day-night rhythm, where it may be cooler at night and warmer in the day. That's highly structured information. And of course, it's potentially predictable at multiple timescales, whether it's at weather timescales, seasonal, decadal, that is 10 to 20 years, or climate change. And the big plus, I think, for the health sector is that somebody else is doing the job. It's measured by the climate and meteorological community routinely all around the world. I really came to understanding something about the connection of these global scale climate processes to local scale initiatives when I came to the IRI and I was working with a climate colleague called Brad Lyon, and we were looking at the relationship of the sea surface temperatures around the tropics, which is the area marked in red, and land surface temperatures. And you can see here in this graph, and neatly illustrates that what's happening in the sea is strongly correlated with what's happening on the land. And those of you who are familiar with ENSO, the El Nino Southern Oscillation, can see even from this simple graph that as whenever we have an El Nino, tends to be followed by a spike in temperature. And when we have a La Nina, which is cooler conditions in the tropical Pacific Oceans, we tend to have a dip in the climate. But over the last 40 years or so, we've seen this general warming of the sea surface temperatures and the general warming of land surface temperatures. On this graph, we also see an indication of when we had these major volcanoes. And volcanoes, we know, put a lot of aerosols in the atmosphere, and that tends to cool down the climate as well. But general principle, what's happening in the sea affects what's happening on the land, particularly in the tropical areas, and this is impacted by ENSO. Now, what drew my attention to this was when we were working on data from a tea estate called Kericho, which is in the Western Highlands of Kenya. And now what I've done here is superimpose the land surface and the sea surface temperatures on a backdrop of malaria, but also on the green line that you can observe there, which is the minimum temperature taken from a Stevenson screen, like a thermometer, at that tea estate. And I can assure you, I'm not providing the statistics, that they are highly correlated with what is happening at the global scale. And this to me was actually quite shocking, because you know there's huge variations in one's experience of the weather from one location to another, but to see how that minimum temperature reflected what was happening in the sea surface temperature really illustrates that global to local connection. One of the opportunities that we get from climate in particular is that for many of the effects, we have natural lags between the climate indicators and what follows. For example, with a vector-borne disease, you may have heavy rainfall, etc., followed by mosquito development in various breeding sites, setting up a transmission cycle locally as infected female mosquitoes then bite additional individuals, and so you get an infected human host, eventually becoming sick and appearing in the health facilities. And that always takes time. You never go from the immediate climate event in this type of situation to the health outcome. So when we observe unusually heavy rainfall or unusually warm conditions with vector-borne disease, we're expecting to see changes in health outcomes in the weeks ahead, providing some opportunity for early warning. A very simple example for this was the extreme rainfall event that occurred in northeastern Kenya following the 97-98 El Nino. And you can see on the graph here, in the grey line is the rainfall, and the blue is the sudden dramatic spike in malaria cases. And a very simple model connecting malaria and rainfall could easily predict the importance of that rainfall event about 6 weeks ahead of the actual epidemic itself. So thinking that we can actually use climate information in early warning, many communities around the world have been looking to bring that information into health decision making, whether it's for flood risk and the associated health outcomes of that, or recently in California with fires and fire risk, or more familiar in many parts of the world, extreme droughts, and of course some impacts directly on vector-borne diseases and other transmission climate sensitive outcomes. So there are many places where it would appear sensible to try and use climate information as an early warning system for health outcomes that we know are connected directly to environmental effects. And of course, if we add seasonal forecasting, if you like, on top of just monitoring the climate, it gives us lots of additional time, maybe 2 or 3 months of additional time to engage decision makers and bring in early interventions. But what I wanted to communicate during this discussion is that I think there are many other areas that we can use climate information in the health sector. And what we have to do to be able to do that effectively is connect the climate information and the health decision timeframes. If you want an early warning system for what's going to happen in the next week or two, then maybe weather forecasting could be helpful. If you want to know what's going to happen in the next season, then a seasonal climate forecast could give you several months of advanced warning. But we also see that there are different time frames for decision making. that are related not just to these short-term responses, but to responding to, for instance, the policy cycles that are developed in government. How should climate information help decisions that are really around the longer term distribution of resources, the establishment of health facility, surveillance systems, etc. And strategic planning takes time. It's not something that you're going to do in the next year or two. It's really around long-term vision. And so you can think of a number of ways that, some of which are described on the right-hand side here, how climate might inform the types of areas of investment that we might want. And of course, if we're looking at investing in infrastructure in particular, we may be thinking many years ahead or many decades ahead. So just really want to think about when we want to use climate information, we have to say, well, what is the type of decision that people want to use it for, and what is the time scale of that decision? I say this because very often people say, oh, we want to do something about climate change, which is really a long-term process, which we are already experiencing, but the climate variability is acting on top, if you like, of the longer-term trends. And when you get down to it, the conversation often reverts back to really short-term decisions. So people might want to act in a longer-term way, understanding the longer-term climate, but effectively the decisions that they're dealing with are often much shorter terms, and we need to be aware of that. Just an example of one of these longer-term discussions, though, this is a slide from Ethiopia, where the climate is incredibly complicated. It's a very mountainous country. It has extremely different climates in different areas, from humid zones to arid desert to highland areas, which are quite cool. And you really do need high quality information to be able to assess the climate in such a complex area. That type of information is now becoming available in Ethiopia, and it's possible to estimate how many more people are now at risk of malaria compared to what would have been the situation if the climate had remained stable, if there had been no warming in the climate over the last 30 years, and we were just subject to the routine ups and downs of temperature and rainfall that goes with climate variability. And this is really because malaria is such a climate sensitive disease, and historically the Ethiopian highlands have really not had that much malaria because they are generally cool. But that is becoming increasingly not the case. Another way we've looked at using climate information in decision making for the health sector is just to get a better handle on the impact of intervention assessments. And this is whenever you have a climate sensitive intervention, doesn't really matter what it is, but you're putting an intervention in, but the thing that you're looking at, whether it's malaria or dengue or cholera or nutrition outcomes, is in some way sensitive to climate, you may overestimate or underestimate the impact of your interventions. And I'll just say this, like a good example in East Africa is that a lot of resources, a lot of money has gone into Eastern Africa to really push down malaria, and that has been, until recently, pretty effective. But East Africa has had, and Tanzania is the example in this case, a whole series of droughts during the periods of interventions. Now, if we don't take into account that those droughts are helping drive malaria down, what is going to happen when we get increases in rainfall in the future? So we do need to take these things into account, and the data is becoming available that does allow that to happen. So in brief, I'm just going to suggest that we can use climate information for a whole range of opportunities. First of all, to better understand the climate sensitive health outcomes that we're engaged in, to estimate populations at risk by understanding where the climate is suitable for certain diseases or not, to think particularly about seasonality of disease and the timing of interventions. And I'd really like to emphasize the importance of understanding seasonality as a precursor. Before we go into thinking about what climate change is going to do, we really have to understand what seasonality already does. And then we can start thinking about using early warning systems and monitoring and predicting health outcomes. And then we can then focus on longer term trends. And as I mentioned just now, the role of using climate in the impact of interventions. So I'm just going to summarize by saying that we need to then think of how we might incorporate climate information into decision-making processes. And I think one of the things that researchers in particular often don't understand is the positioning of research findings. Connecting climate and health outcomes really has to take into account some of the organizational perspectives of the institutions and processes that one wants to influence. You really need to get to know what the policy context is and the stakeholder perspectives, and the practitioner experience in particular. Do people have the knowledge to engage with the information that is available? Do they have the tools? Do they have the capacity to effectively use the information that's given to them? And I say this slide here that follows is like the medical supply system for Tanzania illustrates some of the complexity of trying to insert new information into a decision-making process. If you want to affect decisions, you need to know who supplies the drugs, when do they come in, who agrees the financing, etc., etc. And then I can think a little bit more deeply about who are the stakeholders. Is it really the international stakeholders or the national stakeholders that are going to drive this process forward, or is this going to happen very much at the community level? And then, and very much part of our effort today is really thinking about that practitioner experience. Do we have the resources for the health community to really learn about the climate and exploit the climate in a helpful way? So with that comment, I'd like to just show you that there are some links at the end of this PowerPoint that you may find useful. And I'd like to hand you back to Joy Schumacher-Guillemot back at the WMO. Thank you.
Thank you, Madeline, for sharing these experiences and resources with us. We'll pass back to Simon. Simon, are you still on the line?
Yes, I am. Can you hear me?
We can. Great. Please
Great.
Go ahead. We're looking forward to hearing your presentation on climate.
Okay, apologies for whatever happened there. I'm going to try and pick up a little bit into my talk because we lost some time. But just to quickly review, I was talking about the fact that at the weather time scale, we can see some big differences in weather over distances across the span of the United States, for example. We can even see small differences over periods of distances of just a few hundred meters in the case of rainstorms. And what I was trying to explain was that we at timescales of longer than a few days, we often see these similar kinds of contrasts in unusual weather in different parts of the country, in different parts of the globe, lasting not just periods of days, but they can last for periods of weeks, months, years, decades, even longer. And I think it's helpful from the public health community to have at least a very basic understanding of why we might see these unusual climate conditions occurring, just by getting a very simple idea of how the climate works, how the weather works, without going into the complicated physics that you have to learn as a climate scientist. I think if we, from the health community, if there's a very basic understanding of some of the simplest principles of how the climate works, it helps to identify what opportunities there are for perhaps using climate information, some examples of which we've already seen from Madeline. So I'm going to try and provide a brief theoretical background to some of the information that Madeline has already introduced us to. And so I'm going to show you 6 principles of how the climate works, but these principles are all going to be in terms of knowledge that I would be very surprised that we don't all have. So the first principle shown here is that it's cooler in the shade than in the sun in the summertime. It's the opposite in the wintertime. And of course, this image here is an example from Australia, which is currently experiencing record high summertime temperatures over the last few days. And the principle behind this, why is it so much cooler in the shade than in the sun? And if you're in the wintertime, those of you who are perhaps experiencing clear skies with very little wind, you'll notice that it's much warmer to stand in the sunshine than it is to stand in the shade. It feels a lot warmer if you're standing in the sun than the actual air temperature. And the reason why this is that the sun, with a few very minor exceptions that we don't need to worry about, the sun does not heat the air. The sun heats the earth, and it's the earth that heats the air. So if the earth becomes unusually hot, whether that's over the land or over the sea, we're going to have unusually high temperatures. And of course, if the Earth gets unusually cold, we'll experience cooler conditions. And this principle perhaps helps to understand why in cities we tend to often get the most severe heat waves, because concrete and tarmac can get very hot in the summertime. So if the surface of the Earth is very hot, then the air is going to get very hot too, because the air is being heated by the surface. And it also explains why it's so valuable to have park space in cities, because grass and vegetation will heat up much less than concrete. And so over parklands, we tend to get cooler temperatures than amongst the buildings, even during the most severe heat waves. And perhaps a related principle is that you may have seen some examples of people frying eggs on the ground in areas where it's very hot in the summertime. Now, you could fry an egg on the ground, but you couldn't put an egg in a cup of water on the ground and boil the egg. And the reason why you can't boil the egg, but you can fry the egg, is that it's very, very difficult to heat up and cool down water. It takes a great deal of energy it takes a great deal more energy to heat up and cool down water than it does to heat up and cool down the ground. And so why this is important from a climate perspective is that if you are living far away from the sea or far away from a big lake, the ground is going to heat up a lot in summertime. It's going to cool down a lot in the winter. And so you have much more extreme seasons compared to if you are living near the coast. And so, I mean, we're seeing this kind of problem right now in Australia, where especially in the inland areas, we are as I mentioned a few minutes ago, we're experiencing some record temperatures, and so we currently have this heat wave in Australia. But there are two types of heat waves. There are humid heat waves, and there are dry heat waves. And so when we have a dry heat wave, the temperatures can get up to 50 degrees C, even higher. The humid heat waves tend to only get up maybe in the low 30s. There's a few reasons why that is true, but one of which is this issue I've just been pointing out, that it's very difficult to heat water up. And so if there's a lot of moisture in the atmosphere, although it might feel very hot and sticky, those temperatures are probably not going to get up into the 40s and the 50s. Understanding this principle of why, of the fact that water is a sort of a dampening effect on heating and cooling, also helps us to understand perhaps some of the big forest fires that we've been seeing in places like California. There's also been some in Australia recently, that if the soil dries out, quite clearly, if you have dry vegetation, it's going to be much easier for it to burn. But also, if we dry the soil and the vegetation out, not only is it easier to burn, but because because there's less water available in the ground is going to heat up a lot more easily. And so we're going to see things like forest fires and heat waves occurring quite often after a drought, because after a drought, the ground's very dry, and so the ground can get a lot hotter than if it were wet. The third principle is, you might want to try this whilst you're listening. If you blow on the back of your hand, the air is going to feel fairly cold, but if you huff on the back of your hand, the air is going to feel fairly warm. And it's why when we have a hot drink, we blow on the drink to cool it down rather than huff on the drink. And the principle here is that when you blow, the air coming out of your mouth expands into a larger space, because there's you're making a very small hole in your mouth. And as the air comes out of that small hole, it expands, and expanding air cools down. If we squash air, that air heats up. And so you may have experienced something similar if you've ever had a puncture on a bicycle, for example. When you try to pump the tire back up, the pump gets hot because you're squashing the air. But if there's a puncture, the air coming out of the puncture feels very cold, and that's because the air coming out of the tire is expanding into a larger space. And so we see this principle of expanding air cooling down most clearly with altitude. As you move higher up in altitude, so if you go up a mountain, for example, there's less weight of air above you, and so the air expands, and that's why it gets colder as you move up in altitude. And Madeline gave us an example of this principle earlier on with the malaria in Ethiopia. At high altitudes in Ethiopia, where the air is very cold, it's too cold really for endemic malaria. But what we're seeing with global warming is that as the air as a whole is warming up, those higher altitude areas are becoming more conducive to malaria spreading. The fourth principle is that we bake on the top shelf in the oven rather than on the bottom shelf, and that's because hot air rises. It's how hot air balloons work, of course. And so that the top part of the oven is going to be hotter than the cold part of the oven. And one example of this exact principle being applied in a health context is that there's been hospitals in India where the maternity ward was on the top floor of the hospital, and they were experiencing a fairly high death rate of babies that were born either sick or prematurely. And that's because often it's the top floor of a building that's going to be the hottest part of the building, because the hot air in the building rises to the top floor. And so a simple decision was to move the maternity ward down to the ground floor, where it was a bit cooler, and it was effective in helping to reduce the death rate of the infants. A fifth principle is that if you put ice in a cold drink, or rum punch, for example, it's very effective at cooling the drink down. And the reason why this is, in fact, if you had a cup of ice and at 0 degrees C and a cup of boiling water at 100 degrees C, you would think that if you mixed the two, the temperature of the mix should be approximately 50 degrees C. That's the average of 0 and 100. But in fact, if you do mix the two, the temperature averages out to only about 10 degrees C. And that's because it takes a lot of energy just to melt the ice without actually heating the ice up. We need even more energy to convert water to water vapor. And why this principle is important is I'm going to explain why in combination with my last principle, and that is that we have most of our bad hair days when it is hot. And what this is essentially saying is that the amount of water or water vapor that the air, or the maximum humidity rather, in the air increases exponentially with temperature. So for about approximately every 1 degree C rise in temperature, the maximum humidity can increase by about 7 degrees C. Okay, and so it only feels really sticky when the air is hot rather than when the air is cold, because hot air can hold a lot more moisture than cold air. And if we combine these two principles, it gives us an understanding of why we get the most severe storms, such as hurricanes, only occurring in the tropics, or only forming in the tropics at least. And it also helps us explain the seasonality of such storms. So in the North Atlantic, for example, we're only getting hurricanes forming between about June and November. So just using these 6 simple principles, I know I've raced through them, but if we understand those 6 principles, it helps us get an understanding of how climate varies with space. So if we look at this map here, which is just showing the average January temperatures, you might see over the Himalayas, for example, just to the north of India, the average temperature in January is quite cold. Compared to similar latitudes, and that's because of the high altitude. Of course, you can see a similar effect along where the Andes are on the west coast of South America. And we talked earlier on about the principle that as you go higher up, the air is expanding, and so the temperatures are cooling. We'll also see, for example, over Australia, we're getting very high temperatures in their summertime. The highest temperatures are inland, and that relates to that principle that the temperature of the sea changes much more or much less than the temperature of the ocean. So we're getting the most extreme temperatures in inland areas. It also helps us to understand how climate varies at different timescales. If we can understand these 6 principles. What I'm showing here is 2 maps. The bottom map is showing how much weather varies from day to day. This is a measure of the variability in temperature from day to day. In the top map, we have how much the climate varies from year to year. Now, I should emphasize that the color scales are different. So the color scale on the weather map at the bottom is 4 times that of the map at the top. And just as a very, very crude rule of thumb, the amount of variability in climate from year to year is about a quarter of that from day to day. But if you think about how much climate varies from day to day, especially in the mid-latitudes and the high latitudes, even a quarter of that allows for a fairly large amount of variability in climate from year to year. We also see climate varying at much longer timescales, from decade to decade, not over all parts of the world. But there's an example shown here. On the left map, we have the IPCC projections. So this is the climate change projections for how rainfall will change over Africa, or is expected to change by about the end of the century. On the right, we have how much has climate changed over the last approximately 15 to 20 years. And you'll see that in East Africa, we've seen East Africa get drier, whereas the long-term projections are indicating that East Africa is going to get wetter. And so if we're using information that's at the wrong time scale, if we're using information that's too far into the future, for example, to make decisions about what's going to happen over the next few years, we could end up with a very bad prediction and end up making some very poor, some very unfortunate decisions. So the last thing I'd like to point out is that in order to get good information for different parts of the world, we need to have good climate observations, and Madeline talked about this earlier on. And unfortunately, for many parts of the world, and especially for Africa, there's climate information or climate data are not always available. There's a lot of climate data sets for the whole globe that have got some data quality problems, and so we really need to work with national level institutions where there's maximum availability of data to do some careful quality control and make that available for use in the public community. So I will stop there and hand back to the moderator. Unfortunately, we don't have a lot of time left due to the technical problems, but hopefully we have some time for a few questions.
Plans. Can you all hear my last question? So I was just saying, if you could pick up on your last point and answer the question that's come in about what type of support is available to ministries of health to incorporate climate forecasting in their national plans. So perhaps you could elaborate on some of the resources that national meteorological, hydrological services and other expert institutions might make available to the community. Simon, are you available to answer that question? Or if Madeline is able to answer that as well?
Hi, Madeline here. Can you hear me?
Yes.
Okay, so great question. And I think that the national meteorological agencies around the world, they're relatively new partners for the health sector. Many of them have become interested over the last few years, particularly through the advocacy from your office and WMO, but also demand created at the national level with the health services wanting to understand better how they can adapt to climate change and how climate information may be relevant to them. In particular, the Met services, I would say, have focused on forecasts as a contribution to health decision making, and that is whether it's the weather forecasts or seasonal forecasts in particular. However, the work that we've been doing over many years tells us that really the health sector needs to not only have forecast information, it must also have access to the historical information, the climatology, the seasonality, etc., because that data can also inform a lot of the decision-making processes that they're involved in. So we have significant contributions on the forecasting side, and I would say emerging contributions on the more basic climate information side.
Yes, thank you. And I'd just like to add one point to that, and that is that, you know, clearly the amount and the quality of information is going to vary from country to country, but there has been a useful initiative supported again by Joy's office to create regional centres. So these are centres that help countries over regional scale, especially in areas where the national meteorological services are poorly resourced. So we now have these regional centres, I believe, set up to cover the whole globe.
Excellent. Thanks for that addition, Simon. And we're just going to end with one final question, because you've shown us that even when the information is available and we have some basic knowledge about the climate, we still may need some additional skills and resources to actually apply that information into decision making. So Madeline, could you tell us about some of the core competencies or skill sets or other enabling environment elements that can help overcome the barriers to using this information effectively?
Thank you. Yes, so we have to really consider different levels of the health sector, whether people are working at the community level, the district health management team, for instance, or they're national decision makers or part of the global community. So definitely at the local scale, it's really understanding basic climate information, most significantly around temperature and rainfall, but of course other variables become important dependent on the specifics. And really there, it's understanding the quality of the information that's necessary for the scale of the information, of the decisions that they're making locally. And people need to be able to incorporate that data, look at it against their health data in the surveillance system, etc. If we go up the decision-making levels, if you like, then understanding basically these large-scale drivers. Some countries have huge impacts from El Nino or La Nina, other countries don't. And really, if there's a country that is going to be heavily affected, whether it's Indonesia or Colombia or Ethiopia, then planners that think about resourcing, think about what the likely impacts may be at the national level across a whole range of diseases, what needs to be put in place, etc., and understanding how the seasonal forecasts, which basically use that underlying information, can be used. So I think you need maybe different competencies at different scales, some more to do with the basic principles that Simon has been outlining here, and others really very specific technical information about how to access specific data and bring that data into their own specific tools for local decision making.
Excellent. Thank you. Simon, do you have anything to add to that as we close up here?
Only that you know, Madeline's emphasized the fact that from a forecasting point of view, we have currently primarily weather and the next few days and seasonal forecasts, the next few months are available. There is a lot of work being done to try and improve the forecasts at other timescales, but I'd like to reinforce her point that I think we need to make more use of useful information about what's happening in the climate now and how has the climate varied in the past.
Absolutely. I think that's a great place to close up, that it's super important that we understand fundamentally how the climate works, how it's affecting us today, so that we can incorporate that into understanding how it may be changing and affecting us in the future. So thank you all for the fantastic comments that have come in and these presentations. So I'd now like to pass back to Keith to make some closing comments for us.
Thank you very much, Joy. I'd like to first apologize to everybody for the technical glitch we had earlier on, but it worked out in the end. I want to thank Joy Shumick-Guillemot. You did a fantastic job moderating the panel and giving a wonderful overview of this webinar on climate information, a new resource for the health community, and Dr. Madeline Thompson for doing a superb job describing the interaction between disease patterns, both surface and sea temperatures, and then how this can affect political decisions in a very powerful and important way to have sound investments in health systems, infrastructure. And finally, Dr. Simon Mason for describing so well climate principles by using everyday examples to explain the complex challenges and complex interactions for climate and the need for good climate data. For those on this webinar, please see cugh2019.org, where we will have a whole half-day satellite session at our annual conference in Chicago on March 7th on planetary health, One Health, and environmental health. This will be a half-day session for us to come together to work on initiatives we can collaborate together to address the important environmental challenges we face right now. And during the conference itself, we'll have a very large plenary session on this issue and other opportunities to follow on to collaborate to address the environmental, climate change, and planetary health challenges that we face. So on behalf of all of us at CUGH, I'd like to certainly thank Karen Lamb and Dalal Najjar for their great work in helping to put this on. And again, Joyce, Simon, and Madeline for your outstanding work in providing your expertise and sharing this with attendees around the world. So with that, everybody, I'd like to wish you a warm goodbye. And again, thank you very much for attending this webinar, one of a series from the Consortium of Universities for Global Health. Bye-bye for now.